pandemic is impacting every community in this country, it's having a particularly devastating impact on communities of color.
Black residents are twice as likely to die from the coronavirus than white Americans,
due in part to long-established health disparities in this country.
It was just one person after another one. The African American community is going to be in deep mourning for a long time. There is a lot of people that has broken hearts right now because they've lost not only one family member that they love, but sometimes several family members that they loved all at one time. Before and now, when you came to the crematory, the family went inside the chapel and did their prayers. But now, they won't even let the families come. You just have to drop off the body like we're doing now. Thank you, gentlemen. I'll be back.
I'll be back. And unfortunately, funeral directors all across this country have been going back repeatedly since we entered this pandemic. Good afternoon. I'm Carolyn Sawyer, and Carla Winfrey is joining me as well. Hi, Carla.
Hi, Carolyn, and you're exactly right. Since we have been in the pandemic, we have been funeral directors going back and forth. And for those of you who have lost loved ones, we feel your pain because we also have lost friends and relatives. And that's why we have this show where we look at COVID-19 today. Is one of the things we want to look at as Doctors on Call, the health wrap. We want to continue to talk about the coronavirus. We know that we have now re-entered many cities and in stages 2 and 3. And as we go into those stages, Carolyn, sometimes when you go out, you're noticing that people are not wearing masks, they're not social distancing. We know we talk about it all the time. We know our doctors, every doctor we've had on here has talked about it, but we need to continue this conversation because we need to continue to save lives.
And talk about going out. I shot a promo yesterday from the airport, and really I say promo, but information so that people could get a sense of what was happening in Reagan National Airport in Washington, D.C., how it's not crowded, but the planes are packed. And we'll show you some more information on that a little bit later in the show. I do want to say a shout out to a couple of people. Ms. Walker, I'm about to award her our most loyal viewer watcher. She's only competing with one of my high school classmates, Nancy Smith from Boston. We welcome both of them joining us this morning. Tell us where you're calling us from or where you're actually watching the show from. If you're checking us out today, we really would like to hear from you. This is an interactive forum. We're here to give you information and make the best use of your time in the 30 minutes that we're with you. So you mentioned a second ago, Carla, every one of us, if we're African-American, we know somebody. I remember a phone call we were on early on, and it was you, myself, and a Caucasian woman, and we were talking about people that had just died. And I have a list of 5. And she had nothing, she didn't say anything. And I think at that point, and this was early on, she didn't know anyone. And right. We knew that this was bad. And the fear is it's not going to get better.
Exactly. And we want to talk about, there was an article that I saw in Associated Press, and it talked about just that Black Americans most likely to know a COVID-19 victim. And we're going to just look at this by the colors, basically. The African-American, the Black, is in the orange. The white is in the light blue. And then all non-white in the dark blue. You see that the orange little lines here that you measure when they did this poll, that they are so much longer. For instance, the top one, it says Black 11% versus white 4%. And the question they ask is, have you had a family member or close friend die from COVID-19 or respiratory illness since March 1st, 2020? And even with the non-white is 7%. So if you go down each category, national, metropolitan area, state, the orange representing African Americans, it's still the longest bar that you see when they calculated this data.
It's just jarring. I mean, we have managed, I think both of us have just been pushing through and working through this quarantine. But the reality is it has hit really close to each of us with our relationships with people from work, from play, but individuals who we just had no idea that this virus would come in here and they would not be with us. The other story this week, Carla, that caught my attention, and this is for all y'all running around here who don't think it's real and you don't need to do a mask and it's okay to go to a cookout and a party and a whole bunch of people you don't know. The cost of COVID, this almost knocked me off of my seat. This woman got a bill for $400,000. You hear me? $400,000. She stayed obviously a period of time, and what we're learning is those who are getting treatment who are in for a while, I mean, the ticker tape is just running. It's running. And so this is going to be devastating in terms of, individuals and their personal finances. It's going to be difficult for hospitals that are trying to rebound and recoup cost, which means it infects your entire community. So really, really, you got to take this serious and know that it ain't over. I said that last week. I say it again this week. It ain't over, y'all. It just ain't over.
And you start thinking people that say, oh, I don't want to wear a mask, it's too hot. A little $2 or $15 mask may prevent you from having to face a bill like this.
Absolutely. And there was one other study that people should pay attention to because this speaks to exactly why we started doing this 10 weeks ago. And by the way, this is our 10th episode. If you've been hanging out with us for all 10, we thank you. We really do. It's been quite a journey, but we think that we've made some impact with the information that we're sharing. This is one where they looked at patients with underlying conditions. That's what we mean, y'all, when we talk about the health disparities. They were 12 times as likely to die of COVID as otherwise healthy people. We said it from the very beginning when we had all the experts on and we did the hour-long series and we said, you know what, this is coming. You guys need to be ready. If you had heart disease, you were 32% more likely. If you had diabetes or have diabetes, you're 30% more likely. And if you have a chronic lung disease, you're talking 18% more likely. So again, the risk does not go away.
Absolutely. And, I've always been interested about what happens to you when you get so sick that you're in the hospital. We know the whole pulmonary and the lung, we saw that there. So this is Doctors on Call, and we have a doctor in the house, Dr. Tyson Bell, who is the Assistant Professor of Medicine of Infectious Disease and International Health Pulmonary and Critical Care at the University of Virginia School of Medicine. Thank you, Dr. Bell, for joining us. The first thing I wanted to know is, as I was saying, I've always wondered what happens to your lungs once you contract COVID-19.
Sure. So the virus itself is attracted to the lungs. That's how it enters the body. So it enters through your respiratory tract or your mouth or your nose, and then it causes direct damage to the lung tissue itself. So it actually enters your cells in your lung, attacks them, and then replicates and causes more damage. And then the damage from that point and the disease that you get is caused by the combination of both direct damage from the virus itself, and then sometimes even the immune system that's actually fighting the virus might actually go a little bit too out of control and then cause more inflammation that could actually make you even worse from that point. So it's really devastating to the lung tissue. It can affect other parts of your body as well, but by far lungs are the primary issue, causing really severe pneumonia, sometimes requiring people to need oxygen and sometimes even the mechanical ventilator or a breathing machine.
We saw, go ahead, Carla.
Carolyn, on that chart, we just saw heart disease being the number one. So can you tell us how it affects the heart?
So anytime that your body is infected, it's a hit to the rest of your body's organs. So for instance, if your lungs are under attack from a virus and they don't have as easy of a time getting oxygen into your blood, then your heart has to speed up in order to make up the difference to get more oxygen to your tissues. And when your heart has a speed up like that, it can be under more strain than it usually is. And combine that with other problems that can happen when you're in the hospital, it can really be a setup. So one of the main things that we had seen as far as heart disease and COVID are arrhythmias, which are abnormal heartbeats that can sometimes be deadly or even fatal. and other times even heart attacks or damage to the heart tissue because it's just working so hard. It's running a marathon and it's hard for it to keep up sometimes.
I was asking you a few minutes ago, we told our audience it's not over. What's your biggest concern in terms of where we sit right now? This morning,
Right.
23 players, football players at Clemson, plus 2 coaches, have all tested positive. What's your biggest concern when you hear those headlines and you see what's going on now?
Right. So by far, in a way, my largest concern is that we are seeing many states in the South and the West. So South Carolina is one of them. I would also add Arizona, Texas, and Florida, among a few others. These are states where cases are rising, and some of the things that we look at to track how is the virus doing in the community and are your cases going up, those numbers are all looking like they're going the wrong direction. They're going up. So South Carolina reported 1,000 cases last Friday, which is the highest they'd ever recorded. Hospitalizations in Texas and Arizona are up by 90% in some compared to earlier this year or even last week. It's really concerning to see that. But combine that with what looks like a lack of courage from the governors and leaders of these states to make sound policy decisions that will keep people safe. So, for instance, in Texas, Governor Abbott has not permitted local governments from enforcing rules about people wearing masks. In Florida, Roman DeSantis, where cases have spiked 98%, said that this is an individual responsibility and should not infringe on constitutional rights. And this is not a constitutional argument. It's a public health argument. So it's similar to why do we have speed limits? Why do we require people to stop when the school bus is letting children on or off? It's for the greater public good. And no one hollers about constitutional freedoms when we're talking about public health in those arenas. So the question that these leaders and we need to ask ourselves is, if we accept that we should have speed limits on highways and that we should not run over children at the bus stop, then what is the difference when we're talking about a global public health emergency that is killing millions of people? COVID is, the World Health Organization tracks 282 different causes of death over the year. COVID started off this year at 0. The absolute last, and now it's number 1. It has jumped over every other cause of death, and it's done that in the course of half of a year. So to say that we're not going to require people to wear masks, when we know that it works, that we're not going to require social distancing, and we're going to have rallies in Oklahoma, this is not the advice that we need to give. It sets a bad example. It makes people unsafe. And if we want to holler about constitutional freedoms, then these governors need to ask themselves the question, are they willing to let people die because of their inability and lack of courage to make the right decision and follow public health advice? It's as simple as that.
Absolutely.
Yes. And for your last hard look, people, this is real. For the people who some people still are not believing, as Carolyn was mentioning earlier, that this is real. Can you give us your best pitch as a physician to help us save people, help them save themselves?
Sure. I'll just tell you about my experience taking care of these patients who come in and get incredibly sick from COVID-19 and end up having to go on oxygen and mechanical ventilators. We have visitor restrictions in our hospitals, like many, so families can't come and visit as freely as we normally would. And these are people who have families and loved ones, and they are incredibly sick. We have some people that have been in the hospital over a month, and they're debilitated and get very weak, and causes a lot of different problems as far as their organ function. And even people who survive COVID, a lot of people particularly who leave the ICU, will have what's called post-ICU syndrome. So they aren't able to get back to their normal level of physical conditioning, not able to get back to their normal activities and work and things like that. So if you talk to anyone who's on the front line of managing this disease, where we're still seeing cases coming in, you will get the message loud and clear that this is still a problem. It is still destroying lives and livelihoods, and you have to take this seriously. And even if you are yourself in a low risk category, you have to think about the concept of being a vector, that if you get sick, and even if you're okay, luckily 8 out of 10 people will have asymptomatic, no symptoms, or mild symptoms, but you could pass it on to someone who could then get sick and even pass away from it. So if you're willing to let someone die because of a decision not to wear a mask, then how does that reflect on us as a society and as a people?
We have a quick question for you for one of our viewers. This is Monique Hill, and she says, what is the time frame it typically takes from infection until it reaches the lungs? How fast does that move?
Sure. So great question. So, and I'm going to extend this question out a little bit to talk about why we need to act now when we see cases rising. So on average, it takes about 6 days from when someone gets infected with the virus in order to become symptomatic. And that's if you become symptomatic. So we have to acknowledge that some people are not going to have symptoms at all. But if you do, that'll be on average 6 days. Now, the course of the disease, when it gets really severe, will happen then over the next 2 weeks or so. So 6 days to get symptoms if you get infected. And then over the next 2 weeks is when you get the most ill. And most people will die if they do pass away 2 weeks after they get the illness. And then after someone dies and passes away, it then takes another week for that death to be reported. So if we stretch out that whole timeline from beginning to end, we're at 28 days from when someone gets sick from COVID, gets symptoms, gets really ill, passes away, and that gets reported. Once we find out about that, we're 28 days, a full month behind the 8 ball. So we cannot wait until we see the actions of reopening and people getting symptomatic. We can't wait until we see people start to die more, because that means that we're already a month behind stopping the circulation of the virus.
Wow, great information. You have been so helpful this morning for helping us understand a little bit better about what's happening on the front lines and in the emergency rooms, and what we can be thinking about as we're moving forward. We want to thank you, Dr. Bell, for joining us.
Thank you for having me.
Stay safe. I want to we almost need to do a segment, Carla, every week with people that just do things that make you go,
Yes.
to do, right?
And we'll call it. Or are you serious?
The award this week goes to one of my congressmen. Yes, I'm calling him out. This is our congressman who actually went on the floor of the U.S. Congress without a face mask. And he reported this week that both he, his wife, and his son have been infected with COVID. And so we don't want anybody to be infected. We ask everybody to be smart, everyone to be conscious, everybody to be, be thoughtful, be respectful of your neighbors, and take the necessary precautions that the doctor was just talking about. He also mentioned, Dr. Bell mentioned about Texas and how the governor has said, states can't or cities can't make any rules. Well, interesting enough, in Montgomery, this week they voted down the face mask, whether or not to make it mandatory. Well, in my city, Columbia, they'll actually be voting on it this coming week. And I give kudos to Councilman Howard Duvall, who sent out an email over Facebook and said, what do you think? What do you think? What do you want us to do? And it allowed people to weigh in. Everybody was saying, absolutely, it needs to be mandatory. I think you're going to find more people that are okay with an ordinance that says keep it on than those who are perhaps fighting it under this whole civil rights or constitutional rights platform.
Speaking of political moves, the Governor Bill Lee of Tennessee, he has started Thursday, he announced it, and it's going to be called Tennessee Strong Mask Movement. And he is asking that the corporate community put their logos on masks. It's a movement that the state is going to support them doing this. And he had like Bridgestone's headquartered out of here, the Titans, and different organizations. And maybe that will make people feel a little more comfortable. People like to wear jerseys with their names or their favorite team or their business on their shirts. So we'll see how this will work. And I'm going to get some pictures of some of them and bring them on maybe next week.
Well, I know you were sharing with us an email you got from the church, and it sounds like the church is now offering waivers. I mean, I thought I heard the only waiver I heard in a while for COVID, or the first, but the church is now saying, understand, read, what does it say, Carla? What's the deal?
Well, basically, and I get it, because, as now people are allowing churches to have 25 or 50 or a fourth or third, depending on what state you're in. And from, I have one from a church, and it says, attention, please read. And it's basically just, how you have a sign sometimes when you're filming, post it up. And this is one of the things that they're sending to people, and it's probably going to be posted up, that, we are supporting luring, and there is a liability, and related to COVID-19, but we want you to know that, we are saying wear a mask and social distancing and practicing. And basically, if you're not doing that, you're entering at your own risk.
Well, and risk there is, my friends. My philosophy on waivers, when folks put them in front of you, you might really want to think twice or 4 times as to whether or not you want to even do that activity if you're having to do a waiver, because they recognize the degree of the risk. We asked people earlier, because the comment was made this week that it's dying out. You just heard the doctor. It ain't. We asked folks on Facebook, and I was sharing with our Facebook, our social producer, Hillary, that I have never had a case where people responded with their comments before they usually folks will just like or not like something or love it or what have you. But in this case, people were so expressive. And some of this I can't even repeat because my mother is watching and I don't want to do that. But we got negative. So, we got just getting, it's just getting going is what somebody said. And the question was it dying out? And one of my friends from Alabama, he said, no, but Americans are dying. And so, you can see from the responses, no, only unhinged, uninformed, delusional mindset person would believe that it is. So again, that's a small sampling. We'd love to know what your thoughts are. Do you think that the virus is dying out despite everything we've been telling you? Yes, no, maybe, no idea. What's your thought? Let us know, because we would definitely like to share the findings of what you're sharing during this conversation at the end of our show. Lots of news happening this week, but again, we want to focus on things that we think you should pay attention to. I was talking about being in the airport and getting on a plane yesterday morning, and you could literally roll a bowling ball down the halls in Washington National. But look at the plane. You might be able to get the ball down the aisle, but every single seat on that airplane was taken. People got on with their own renditions of masks. Some I'd never seen before. The one woman looked like it was like a bio warfare with that mask on. But this gentleman, who was my seatmate, had on a mask that somebody knitted for him.
Knitted. Carolyn, yeah. Knit. You crochet. I've knitted when I was a child. There are holes in knitting and crocheting that are not filled. When you make your mask or hat or scarf, there are little holes in there.
I was troubled, and I'll share that with my airline, but I was troubled. We really need to take this serious, people. Aside from the fact it's too hot to be wearing wool in the winter, in the summertime, but a knitted mask is not where I think folks want you to be or need you to be. And folks are giving them away, by the way, in some instances when you go into various places. The travel issue, got another interesting email from a colleague who, this is Audrey Edwards. You remember Audrey?
From Essence.
Essence.
Magazine.
Audrey posted on Facebook she went to go and try to do a test, and they were out of swabs. That's not the first time I've heard that. More people are getting tested, but the PPP issue seems to still be a bit of an issue out there. So she was going to do that because Audrey has actually been living in Paris. And over on the left, you'll see that's the newly released cover of her book that we're all waiting for, Carla. Audrey is an amazing writer. And so you should stay tuned for American Runaway. It's Black and Free in Paris in the Trump years. I would suspect this will be on the bestsellers list. It's interesting. Her publisher made her come back and do another chapter or closing chapter that actually includes what's happening with this pandemic. So look for that. But what she said is she was going to do this test because she's trying to go back to Paris. And what she found is there was some call for having virus-free papers. So I would tell any of you all who are actually thinking that you might be trying to run away or go to another place, an island or someplace, you might want to check first and check with the embassy in that country, because what she heard in the Paris instance was that Paris wasn't exactly excited to be taking people from America. Why? Because our numbers are going up. They have not gone in the opposite direction.
Well, we definitely know one thing that can keep your numbers going in the opposite direction. And that is what we're going to talk about as we go to this break.
To help protect others from COVID-19, DHEC encourages everyone to wear a mask or cloth face covering when in public. Make sure your mask covers your nose and mouth, and you can breathe through it. Remember to clean your hands before and after putting on your mask. And try not to touch the mask or your face while wearing it. Don't use a mask on children under the age of 2, and don't use surgical masks needed by healthcare workers. Help stop the spread. Visit scdhec.gov/COVID-19.
And thanks to our friends over at DHEC who are continuing to get the message out about the appropriate mask that you want to put on and you want to keep it on, and washing your hands. So critical. You know, Carla, I don't know what, a lot of people don't realize we were going along leading our lives, and then
Yes.
came along, and then I called and said, hey, we need to do something. You're a producer. We used to do journalism. Surely we can figure out what important messaging we can get out there. But what a lot of people don't know is that Carla is an amazing award-winning documentarian and has a special that you've been working on. And we wanted to have you talk a little bit about that and share it, because it falls right into what we've been talking about on the Health Watch.
Exactly, mental health. And we have talked about it with psychiatrists and psychologists on the Health Wrap. But this is a project that was done with Antioch AME Church in Stone Mountain, Georgia, my other church. I have one in Nashville, I have one in Atlanta. And we did this project because we had done something here at the Nashville church talking about how your mind matters and caring for your mental health. We talk about physical health all the time. And so this is just a preview. It's going to run on the Black News Channel this weekend. And I just want to give you a little snapshot of what you're going to see in the documentary.
We worship you. The doors of the church are open to talk about a topic that is often taboo, especially in the African American faith-based community: mental health.
It's a stigma because oftentimes people in the church, we have been taught that the Lord can do it all, and He can, but we fail to educate and teach our people that God uses people. So people have to understand that God, as the popular saying now, I need Jesus and my therapist.
But we start fanning. I don't know why we always fan. Why we always fan people? And then people will turn around and say, I knew something was wrong with her when she walked in.
And I attempted to hang myself. And I remember that. I remember I used a tie, and I tied it around my neck, and I was standing on the stool. And when I stepped off the stool, I felt my extremities get numb, like my fingertips get numb, my toes numb, and I just fell.
And those are very powerful stories, and people having the courage to tell their stories because they want to help, especially draw attention to mental health in the faith-based African-American community. The special will air on the Black News Channel Saturday, today, June 20th, and Sunday, the 21st, tomorrow at 2:30 p.m. Eastern Time.
Carla, I don't know. Can you hear me? Do a thumbs up if you can hear me, because it could just be on my end that my audio was such that I could not hear you. But I want to make sure that people get this information, that it is airing tonight on the Black News Channel. And or this afternoon, 2:30, I keep saying night, 2:30 this afternoon. Mm-hmm. So please check that out. It's an important discussion we're having in this community, and we need to continue to have it. And especially now, given all that we're going through. We've got another break. We'll be back from the break. We understand some of you all have answered the poll questions, so we'll get those in. And then we'll wrap up. We're going a little long today, but you know what? It's good stuff. Yes. We'll be right back.
This is Dawn Staley, head coach of the University of South Carolina women's basketball team. In the fight against COVID-19, we all have an important role to play. Let's stop COVID-19 and spread caring. And remember to stay careful and stay connected. Visit DHEC's website for more ways to stay South Carolina strong.
Welcome back. We have a couple other things that we want to be sure to share with folks. And one is the story that I saw this week that, given everything that we have been, the Emanuel 9, the shooting here in Charleston, where 9 individuals were murdered as they were at their Bible study class. And it was also obviously a lot of news coming out of Atlanta regarding the police shooting in Atlanta. But this particular story, when I saw this, I said, you know what? There is good in this world, and I thought we should share it with. This is David Muir from ABC News, y'all.
Finally tonight here, America Strong, the student about to graduate, about to sing, and then this.
Oh, say, can you see?
Madison Hallberg was preparing to sing the national anthem for her virtual commencement at Portland State University when a man walking by heard her warming up and signaled to the crew he'd like to join her. And so he did.
And the rockets regular, the bombs bursting in air, gave proof through the night that our flag was still there.
Tonight, Madison telling us she was moved by the moment she was suddenly sharing.
Hi, David. It's symbolic for what we need to do as a people and as a community is to not try to outsing the person next to you, but blend with them and harmonize with them.
That star-spangled
That man who was walking by, Emmanuel Henry, is a trained opera singer. And tonight he says he's grateful she was up for that duet.
It was a beautiful moment that we shared, and in that moment I realized that it's essential for us to raise our voices in empowerment and in love with one another.
and the home of the
The unexpected duet for graduation, and we loved it and what it shows. I'm David Muir. I'll see you tomorrow. Good night.
Hi, everyone. George Stephanopoulos.
Perfect harmony. Perfect harmony.
Really enjoyed seeing that. Let's look at some of the poll stuff before we get out of here, because we did want to hear from some people. Wow, tons of stuff. Looks like we got folks pretty much saying no, I'm troubled too, very troubling. Lots of feedback. They're talking about the PPEs will be an issue of supply and demand, continued problem. So people are paying attention to it. Monique is saying very troubling. We appreciate your feedback and staying on top of the issues. We got to stay woke, y'all. Got to stay informed.
Yes. And next week, Carolyn, let me quickly tell you what we're going to have. This is going to be really a treat. We have an African-American farmer who is also a registered nurse, and we visit with him at a public housing community here in Nashville and just take a look at what's going on. We're going to talk about it next week, but take a look at this.
If all you have around you is fattening foods, chips, cookies, cakes, and pies, and you don't really have any real groceries, then you have no choice but to, be unhealthy.
So that's what I don't want these children to go through. I keep hearing about kids being hungry and, families being hungry. This is a way for me to help mitigate this. Gardening is one of the most relaxing things that I've found for myself, and also in talking to the kids over here.
Tomatoes and the peppers. Then we can have eggplant parmesan, which is one of my favorites. That go to plant right there. So many different variety of foods that's growing right here in our backyard that these kids are going to be able to raise and grow.
I walked outside one day and it's this little bit of fig, and then I come back outside and it is just beautiful,
So that's next week on the Health Wrap.
Maybe I can find a farmer who can do this garden, but I need some veggies and some more than my herbs, right? I need something going on.
Okay.
But yeah, that great story. I look forward to that next week, Carla.
Yes, and the gentleman in the red is a celebrity chef who has been on one of the cooking celebrity chef shows, and he's quite a character, so it's going to be a great piece.
See y'all later.